In today's video, I want to say a little bit about influenza again. We've talked about flu vaccines, we've talked about mismatched strains. One thing I think is important to remember is that flu has specific antivirals. Drugs like Tamiflu or baloxavir, which is also known as Xofluza, are really important. I'm saying this because what we know is that people underutilize the antivirals. Sometimes a pediatrician thinks it might not be necessary. And studies show that many pediatricians, for example, don't follow the guidelines, don't give enough Tamiflu to people. And Tamiflu is not just something that makes you better faster. There is data that shows that it can prevent you from getting more severely ill. And I think it's really critical that when someone tests positive for flu, they talk to a provider and say, do I qualify or would I benefit from an antiviral? What we find is sometimes doctors will prescribe an antibiotic, which is completely unnecessary for influenza in and of itself, but not an antiviral. And I think that we're suboptimally treating a lot of people, and then they get worse, and then they show up in an emergency department or an urgent care center, and some of that could have been prevented if Tamiflu or Xofluza were given up front to prevent the severity from increasing. And yes, you do get better faster with these drugs as well. They do decrease contagiousness as well. And there is a window. The earlier you get them, the better. So if you're a low-risk person and it's been about 3 days of symptoms, there's probably minimal benefit for you at that point. If you're a high-risk person and you've got flu, you should still be getting Tamiflu no matter what. Or if you're hospitalized for flu, you should be getting an antiviral. But for a low-risk person, we try to get the drug on board within 72 hours. The earlier, the better. But it's something that people should start asking for. And there are home tests for flu, so you can test yourself at home for flu and then call someone and ask them about an antiviral. I think that this is something that is going to be important as we start getting into the flu season. There are several states now reporting high activity of flu. Not all are, but it is starting to ramp up. Again, the vaccine is really important, even if it's mismatched. So there is still time to get the vaccine and get benefit from the vaccine as well. But this was more about really emphasizing the need to use the antivirals more optimally and for patients to be proactive about asking for them from their providers.